Thank you so much for being with us.
You're welcome. Thank you for having me. This is great.
Now, I've given you the controls now, Dean. You're in control here, so you should be able to share your PowerPoint and we can get started. Let me know if it's working.
Wonderful. Okay. Well, let me first just thank you for the introduction. Really appreciate that. So, my background, as Rachel mentioned, I'm a biochemist, cell biologist. Back in the day, I studied that. I studied molecular virology for a little bit as well, and then got into cell growth metabolism. And over the years, have developed some expertise, I guess, in metabolic health and regenerative medicine in particular, utilizing stem cells and also immune cells for cancer therapies. But we'll talk about the products that we've got on the Shoply platform within the Simpler Health shop. But first, I'll give some context as to why these products might have some importance and could potentially make a difference for you. So let me just share a presentation here with you. So let's talk about restoring health, something important to everyone who's breathing. There we go. So there's this problem of chronic diseases. If you're alive, you're getting older. Um, it's all about survivability. I loathe to use the term longevity and that commitment because it really is about survivability. And you really want to develop the resilience to better handle the onslaught of insults that life dishes out that really results in these sort of endpoints from cardiometabolic disease, cancer, dementia, and neurodegenerative disorders, vascular disorders, affects way more women in particular than breast cancer itself. Pain and disability. Osteoarthritis is the leading cause of pain and disability in Australia and the US. And then also, not only do we want to live longer, we want to be able to live well enough to enjoy those latter years of our life. So that's the problem. And we know that stuff conceptually, but really what you might be more familiar with is some of these terms that get used as we grow older. People experience migraines, obviously, you or someone who's been at the effect of cancer. But let's talk about high cholesterol that GPs are diagnosing all the time with pathology results, non-alcoholic fatty liver disease. This is the leading cause for liver transplants. It overtook alcoholism and infectious diseases many years ago as that leading cause. Metabolic syndrome is something that people aren't too familiar with, but it's the precursor to the majority of all of the ill health, probably I'd say as high as 80 to 90% of ill health that we deal with. Type 2 diabetes is on the rise, etc. But you might be familiar with polycystic ovarian syndrome or joint disorders, like I mentioned, osteoarthritis, even people who have sleep issues and mood disorders. There is a common underlying phenomenon that leads to these clinical outcomes. So I designed this pyramid just to help educate people in that the severe morbidity and mortality that we see and hear about when asked the question, why did they get so sick or why did they pass away? There's underneath that some kind of diagnosis. They had cardiovascular disease, type 2 diabetes, a stroke, dementia, osteoarthritis, even cancer. This is where often our inquiries stop. But if you look below that, what's been happening for a long period of time and what have people tolerated? Well, weight gain, intestinal dysbiosis, gut bloating, gastrointestinal dysfunction, musculoskeletal pain and dysfunction. People just put this down to aging. It really doesn't have to be the case. Decreased sexual vitality. You think you're just not into life or your partner that much. No, there's something else physiologically oftentimes going on. And compromised cognitive function is something that we don't necessarily notice ourselves because we're in the middle of it all. But what's underneath all of that, if we can impact three or four fundamental aspects of our human physiology, our metabolic system, our gut health, our immune health, along with that, and cognitive prowess. So this is where I think we can have the biggest impact in health outcomes in the community. And we're going to be able to do that by educating and empowering the health consumer to be more accountable for their own well-being. But they can only do that if they know what they're doing and they've got access to the right products and technologies to be able to do that with. So Simpler Health, Simpler is actually an acronym for those that might be interested. Not only do I try my best to simplify things and provide people with actionable accesses to make a difference in their own well-being, but Simpler actually stands for the science of immunometabolic preparedness for longevity and regeneration. So that encompasses my areas of expertise and interest. I work with regenerative medicine experts. I've trained many of them myself. I ran the first in-clinic physician training workshops teaching doctors how to perform these regenerative medicine procedures in their own clinics. That was back in 2014. Over the years, I've had involvements in different circles with regards to regenerative medicine. But I also train and develop health coaches, and we make these available for health consumers. You need a champion who's there with you along the way, someone that you can be a demand of for the coaching, learn from, and someone who can support you and concierge you through the entire process, even if that means navigating the healthcare system, whether it be here in Australia or elsewhere. And this is in combination with what I call combinatorial approaches for optimized biology. I'm a biologist, so I'm always looking at things from a systems biology approach. And this is utilizing whether it be nutrition and certain products, how do you use that in context, in the right dose, what timing, etc. You need to understand that, and that changes. It's dynamic as you go through your journey. That could be paired with technologies like hyperbaric oxygen, plasma exchange, photobiomodulation therapy. A lot of the biohacking scene are cottoning onto this now and making it more readily accessible and available for people. So my three primary clinical programs include regenerative well-being, performance well-being, which neurodegenerative disorders, gut disorders, I focus a lot on those two areas, and also aesthetic well-being. Not really my field, however, I have opened the 2-day scientific program for Cosmeticon 3 years in a row. I've designed programs and protocols for aesthetic medicine, and I work with a number of those clinicians as well. And I've helped to design skincare products using exosomes from stem cells and what have you. But my real passion is how do you get people to think and move better? And for those that have degenerated or are dealing with a particular ailment, how can we support them with more natural ways to heal that may include stem cells or immune cell therapies? These are some of the modalities that we utilize. I work with some of the leading experts in stem cell medicine throughout the world. I partner with the best of the best in Japan. I'm trying to bring those therapies to the rest of the world via some innovative health-focused special economic zones in some Asian countries, such as Indonesia and the Philippines. I work with leading experts in neurobiology, including Dr. Kristen Willemere. She's a colleague of mine. She's the best-selling author of Biohack Your Brain. And she founded the Willemere Center in Los Angeles, of which I am a founding director of. The gut microbiome is absolutely imperative to consider when making any attempt to restore health. And I work with some of the best there. This is unfortunately my colleague and friend, Professor Tom Borody, who recently wrote this book called Shit Happens. He's a famous gastroenterologist. He just passed away a few weeks ago, but we're developing some innovative projects. So I look forward to furthering that work and making it more readily available for people. So as I said, I helped to pioneer some clinical applications of stem cell medicine. So if you think of regenerative medicine, It's very difficult to regenerate tissue if you don't first handle the inflammatory background. So I liken it to the bushfires here in Australia. You can't think about regenerating the bush until you first put the fire out. So in this case, this is Mary. She was one of our first patients that we ever treated. I opened a stem cell clinic in Sydney back in 2017, the start of 2017, and we were using the patient's own fat-derived stem cells, isolating them, growing them to high numbers, and then injecting them into their osteoarthritic joints. Not only did we save Mary from surgery, improve joint mobility, and decrease pain, we also helped her remove a considerable amount of excess fat that was just causing an inflammatory background that was also contributing to tissue degeneration. You can see her here on the right holding a silicon model of fat that's about 5 pounds or roughly 2.3 kilograms of fat. So if you think many multiples of that, if you're a few kilograms overweight, dispersed throughout your body, wreaking havoc on your metabolic system. Um, I helped a lot of people lose weight and then developed a bit of a reputation for that over the years. So we've helped many hundreds of people now restore metabolic health. We do this with no drugs or peptides, no surgery, no strenuous exercise is necessary. And we achieve results in the range of 20 to 40% loss of total starting body mass, which is a considerable impact on the quality of people's lives. From people who just really want to transform their life and their family and alter their careers and start their own family, etc., to those who are looking down the barrel of really severe potential ill health with cardiovascular disease, and they just really need to handle it fast. That gentleman lost 96 kilograms. We utilize a clinically validated and medically designed approach that has been shown to, in 12 weeks, reduce total body mass by 15%. So, to put that into context, if you were to use Ozempic, for example, the clinical studies of Ozempic showed a 12 to 15% loss of total starting body mass over an entire year with diet and exercise. We accomplished that pretty easily within 12 weeks with no strenuous exercise and no medications. This is 36 patients, again in 12 weeks. Significant reduction in these are patients on statin drugs already, and they were able to further reduce their cholesterol by another 17%. But importantly, 58% reduction in triglycerides, which is significant. Take that out to a bigger cohort, 750 patients over 12 weeks, a 40% reduction in triglycerides. What about sick people? This is 24 breast cancer survivors. Post-surgery, they lost about a 20% amount of total starting body mass, but more importantly, a 40% reduction in C-reactive protein, which is a marker of inflammation. So, as I said, if you want the body to heal and regenerate and the tissue to remodel, then you need to significantly reduce your inflammatory response, and you can very effectively do that from a nutritional strategy. Now, this is not just for reversing metabolic syndrome, type 2 diabetes, and losing weight. We help a number of people with specific autoimmune diseases. Often they present on the skin. This is a woman at the time, she was 44 years of age. She had psoriasis covering 75% of her body, which she had had since she was 8 years of age, and nothing had been able to help. And then we were able to support her to clear that up. These photographs are 3 weeks apart, 20 days. And that was about more than 6 years ago, and the psoriasis has never returned. So that was a really great outcome for that woman. She also lost 22 kilograms. This young man, 26 years of age, severe, very severe eczema. This is due to topical steroid withdrawal. And again, medications, various other nutritional strategies, naturopathy approaches weren't effective. His mother was very concerned about him. So she allowed me to contribute. And again, we made a difference to him again, these are 3 weeks apart. You can see because he's a young male. He started feeling more confident and going to the gym, and very quickly the hormonal sensitivity resulted in significant and noticeable muscle hypertrophy. So that was a really great outcome to his quality of life. He's now traveling the world and really enjoying life now and sends me updates every now and again, which is great to see. How we do that is via this nutritional intervention. If you see the histogram on the left, this is kind of the standard Australian diet where people consume roughly 50% of their total caloric intake is from carbohydrates. Those who are trying to lose weight just eat a significant amount less. However, what happens is they're still consuming carbohydrates, stimulating insulin response from the pancreas. Insulin is the most, or one of the most pro-inflammatory hormones. So that doesn't help the case necessarily. And because now they're under consuming protein, there's a significant loss in muscle mass. And the clinical studies across the board, at least 25% of the weight lost is often recorded from muscle mass. And that's unacceptable because muscle is the primary calorie burner. You don't want to lose any muscle mass. For those that are following a do-it-yourself keto diet, there's the carb restriction. Okay, great. But then there's often the overconsumption of fat. If you're in the or have a commitment to lose your own body fat, then you don't need to consume exogenous fat. Oftentimes, that's not real great for the gut microbiome either. But something's got to give to create a sufficient caloric deficit to lose the weight. That's the only thing that really drives that. So oftentimes there's a protein insufficiency as well, plus insufficiency of micronutrients. I take people through and educate them in how to, in a guided approach, use a very low calorie, highly ketogenic diet that's nutritionally complete and do it in such a way that it has muscle sparing effects where you don't lose any muscle and therefore your basal metabolic rate remains constant. And the caloric deficit you steal from your own fat stores and retrain your metabolic system to preferentially burn your own fat. That's for a temporary period of time. And then there's a transition period where we take people back to a more Mediterranean style way of eating. And then they can sustain that for evermore. Exercise is not necessarily required. I do like people to move more for the brain, but it's not required to lose that amount of weight. However, to sustain those health outcomes, exercise becomes absolutely critical. So that's a little background on me and Simplr Health. And I'm also developing, as I mentioned, regenerative medicine infrastructure overseas. So that maybe can be for another one of these in the future. With regards to the products that we offer on the Simplr Health shop, I've got a few I'll just quickly take you through if that's okay, Rachel.
Yeah, let me jump on here and share this. So just a little bit of a testimonial here for Dean. When I was first onboarding Dean onto the platform in 2.0, he was telling me this whole story. I'd just come off the back of a very long road with IVF and had just not long had a baby. And I said to Dean, I bet you, I have tried everything. I bet you your protocol does not work. It will not work for me. And Dean's like, Rachel, it works for everyone. And I said, no, it won't work for me. Trust me. So I thought about it for a couple of weeks and it got the better of me. I contacted Dean and said, okay, put your money where your mouth is. I want to give this a try. And I started in March and we are now, what are we now? We are now in November and I'm down 18 kilos with 6 more to go. And yeah, look, for me, it was the best decision I ever made. For me, it wasn't about not knowing what to eat or when to eat or anything like that. It was just, I'd obviously, with everything else that had been going on in my life, there was stress, there was a lot of gut health issues and not taking the right products, thinking I was taking the right products, but not understanding completely how those products worked in conjunction with each other. And yeah, just by aligning all of those simple things, I had to eat my words and say, Dean, your protocol does work. So that's just a little bit of a personal testimonial there. So I'm just going to share the store here. So this is what Dean's store looks like. This is Simpler Health. And Dean, a lot of these products on the store here, I know that you have reviewed at length, and they pass Dean's test to ensure that they are worthy of taking. You can see that, Dean?
Yes.
Okay.
Yes, I can. So if we just start with the Bear Well brand of products. So I like championing Australian innovations and products and making them available to people around the world as well. But the Bear Well product, they come in, this is a whey protein product. When it comes to whey protein products, particularly here in Australia, because our dairy industry is so great, the market is really saturated and it's difficult to find the products with just the highest quality. And I prefer very simple. I like to keep things really simple. I don't like an excess of ingredients or components within various products because you like to mix and match and you don't want to create too many overlaps. And so, what we do at Simpler Health is not only approve and provide certain products that can improve the efficacy of your journey, but we also sell them as well and champion them. And I consult to some of these brands and help evolve their products to make them even more better over time. So this comes in 1 kilogram bags or these individual sachet type products. Farewell is fantastic. They've got three flavors: a berry flavor, chocolate, vanilla, and an unflavored. They have the highest quality whey protein, minimal ingredients. The flavors are very natural, and there's no guar gum. So I like that for people. You can imagine those that we deal with at Simpler Health have a number of sensitivities. And so we try and reduce that as much as possible. Unlike other whey protein products, the ingredients in Bear Well brand are limited to whey protein. There's no guar gum or vegetable gum, and people find them the flavor profile very like a breath of fresh air, very natural tasting. So that's a really great product. Whey protein as a meal replacement product is probably the superior option in terms of amino acid composition and its ability to protect your muscle mass whilst you're in a caloric restricted diet. Um, Now, shakes are great. Um, they're convenient and very easy to use and palatable, but you also need a variety of crunchy, salty, sweet. You also need some products such as protein bars just to, um, add some variety. And I've tried so many different products. The Smart Protein bars from Smart Diet Solutions, again, based down in Melbourne, Australia. These are undoubtedly best in class, best products in terms of protein bars on the market. The variety of flavors are fantastic. They're, they've got a good amount of prebiotic fiber. Prebiotic fiber can help again with the gut microbiome. It helps those bugs in your gut produce short chain fatty acids such as, butyrates, etc., which are beneficial for your intestinal system and also your immune system. And then whey protein isolates, which is again the superior protein source, natural flavors, sweetened with stevia, 60 grams. You got to chew them. Mastication, jaw movement is important for brain, gut, all of that. And unlike other bars that maybe overdo the prebiotic fiber, they boost it too far. This one sits at around 20 grams, and then about 20 grams of protein, and that's pretty much all that's in there. And the flavor options are again fantastic. So I wouldn't recommend, more than one or two of these per day, but they're incredibly convenient and they're getting a lot of traction in the market. So consumers are absolutely loving these because they're so damn good. So that's in terms of,
I think what's also great about them, Dean, is when you go into a store and you look at a product bar and the ingredient, you've got to lift the flap and you've got to keep reading and reading because the ingredient list is so long. I think there's probably what, 7 or 8 ingredients in a bar like this. So when you're comparing the smart bar to the store-bought bars, there is no difference from a health point of there's massive difference, I should say, from a health point of view because the ingredient list alone says it all. And I think that's where the traction is coming from in the market. Absolutely.
yeah, yeah. I mean, you need something substantial. It needs a good mass to it. So you feel like you've eaten something, so it sits in your gut. And you don't want to consume bars with too many sugar alcohols like maltitol, sorbitol, etc. It's disruptive to, again, your gut microbiome. So speaking of the gut microbiome, I'll just introduce and share this product from ProGood. So ProGood again is an Australian developed product. Uh, John Ellerman is the microbiologist that developed this. He led a team with the CSIRO and University of New South Wales in Sydney to develop this probiotic. It's a so probiotics are an interesting one because there's so many different probiotics on the market. You want a probiotic that's in high enough numbers together with a prebiotic that's been clinically demonstrated to enhance the proliferation of those bacterium such that when they get into your gut, they're in trillions of cells, which is what you need to have any sort of meaningful, clinically meaningful impact on the bad bugs that are causing some trouble in your gut. So when you consume a probiotic, um, like 1 teaspoon of this would be the equivalent of about 60 inner health plus capsules, right? So 1 teaspoon, you just put that in your shake or water, it's tasteless, and it can have a profound impact on your gut. There's been clinical studies. They've been using this in New Zealand in colorectal cancer patients. The Australian military forces have used it in PTSD. So it's getting some good early emerging clinical evidence supporting what we've known for a long time about this product, ProGood. So use that in combination with a controlled diet, you can have a massive impact on your health outcomes. So that one's a great product as well. It comes both in a jar like this, you keep that in the fridge, or there are travel packs available as well, where the prebiotic, which is the fiber, and the probiotic, which is the bacteria, are separated. So it just improves viability at ambient temperature, so you can travel with that. So that's protein for your diet. You've got the ProGood probiotic for your gut and your immune system. And then in terms of cellular health, so it's all the way from what goes on inside the cell all the way through to behavior change. That's what Simplr Health focuses on. And as a medical biochemist, I'm super, super excited by Continual G. This is the only product on the planet that can effectively boost your glutathione levels inside your cells above homeostatic levels. So, what does that mean? Glutathione is the master antioxidant in your cells. Every cell, including bacterium, have glutathione. Glutathione is the antioxidant that mops up the free radicals, the reactive oxygen species that cause cellular breakdown and damage molecules and cell membranes and DNA. So the more free radicals, the more glutathione you use up. And when you use up too much of your glutathione, because there's too many free radicals being generated from poor lifestyle, no sleep, maybe even sometimes excessive exercise, then you deplete your glutathione levels. And there are some other supplements on the market that claim to be able to increase your glutathione physiologically, biochemically. They just don't do it. In extreme cases where paracetamol toxicity in the liver, for example, some of these products can save your life, but that's in an acute medical emergency situation. For overall health, you want to be able to boost your glutathione levels above homeostasis. There's one molecule that can do it. It's called gamma glutamyl cysteine. It's found in milk and in egg whites. And we believe that it helps to protect the offspring from the potential of infectious diseases such as viruses, because when a virus infects a cell, one of the first things it does is it turns off the glutathione synthesis pathway. So, to boost your glutathione levels, you would take this. Continual G is an Australian product. It's manufactured, however, in Texas, the US. So it's readily available for the US market. We can make it available for customers in Australia as well. It comes in a drink form, and this too has a little bit of prebiotic fiber, sun fiber from Japan. And then there's a capsule form as well. And there are some emerging data coming out looking at its role in neurodegenerative diseases. And a study my colleague, Professor Joseph Maroon in Pittsburgh, is doing that study in NFL players, people who experience significant knocks to the head, including Navy SEALs who are on the dinghies, hitting the waves constantly. Their brain is slushing around in the skull. So we're looking at to see how effective consuming this product can be in protecting the brain, especially in those with mild cognitive impairment as well. So it's a good range of products. I'll continue to vet and add products over time to the Simpler Health shop, and we'll also have some educational products that we'll add there as well, and some technologies in the near future.